Uh, Hello everyone. Today I'm going to talk about applications of data analytics, machine learning and AI, mainly the whole data science thing in healthcare. Before I begin, I should clarify uh, why I have chosen this topic, uh, why is it important, uh, and then I should give a summary of today's discussion. Data science, machine learning, data analytics, all these things are proving to be very, very important in case of healthcare because of certain things. It's not about technology, it's about the healthcare system itself. Just imagine when someone is admitted to a hospital or someone goes to a doctor's chamber, what happens? The first thing, uh, a series of tests are performed, and based on the results of those tests, the doctor or doctors give some advice and some medications to alleviate the problem the patient is facing. The tests that are performed, healthcare test, a blood test, can be blood test, can be something else like ECG or blood pressure or blood sugar or something like that, are digital data, right? Now, the whole thing, the whole healthcare system is dependent on data analysis from the very beginning. Uh, if we go to ancient times, then doctors often listen to the patient. Uh, what are the problems, and based on that, they prescribe some medicine, prescribe some uh, remedy. Now the thing is that with the advent of time, population has grown. Okay, so there are today there are more than 6 billion people in this world. Along with that, type of healthcare that needs to be provided to these people have also changed. So in today's world, it is apparent or uh, it is necessary that we should give proper healthcare rapidly, means with reasonable amount of time, within reasonable amount of time after the uh, disease or the problem has occurred to the patient, and that treatment should be as accurate as possible. So we want to lower the false treatment or negative treatment or negative result from the healthcare system. And it has been done. The average age of people, say for in India, during our independence in 1947, 1950s, the average age of Indian male were below 50. Today it is almost 70. The rate of newborn deaths has gone down rapidly. Uh, it is close to, it is in one figure, less than 10%, I guess. I'm not sure about it, but it is very, very less. In the last 70 years or 60 years, we have in a developing nation, as a developing nation, have made huge stride in healthcare. Okay. Now think about the developed nation. They have done more. So it has already been done. Now the challenge is that uh, with climate change, with food habit change, with lifestyle changes, diseases have also evolved. The thing is that if we can use data analysis, data science, machine learning, AI, whatever uh, type of technology we can think of to speed up the treatment, to make the treatment more accurate, more accessible to everyone, then it will be good for humanity. So without further delay, let's start our presentation. Uh, so I'm going to talk about these main topics: predictive analytics, population health management, fraud detection, and there are some more. And after I give these uh, main topics, I'm going to explain these things. I'm going to give some use cases also. Okay. So predictive analytics, what it does, the it is a way of forecasting uh, outcomes of patients. For example, someone admits to a hospital with some disease. Now, if we can, if we may predict the outcome of the patient's health, then it will be very, very useful for the treatment that will come after this. So, as I have said, after a patient is admitted to a hospital, a series of tests is performed. And after those tests are performed, if we can predict what is going to happen and what kind of treatment the patient needs, then it will be very, very useful or very, very helpful for the doctors to uh, give uh, proper treatment to the patient. Another thing is hospital readmission. Means once a patient has been discharged from the hospital, suppose someone has some operation, surgery, and suppose, let me be more specific, concrete. Suppose knee replacement has been done, okay, and a foreign object, a steel knee, has been replaced inside the patient. It has been the case that some patients do not need any kind of after readmission, uh, they heal properly, but some do. Some of them has to be readmitted to uh, take care of things that has gone wrong after the operation, after they have went to home. So if we can predict that thing also, that will be also very, very helpful. So that is more or less predictive analytics is all about. Next one is population health management. Now it's quite easy to understand because these days we all uh, know what mass virus attack on population can be. What kind of uh, thing it can do. I'm talking about COVID-19, of course. Uh, how fatal it can be. What are the challenges of hospitals that try to treat those patients? So if we can identify and manage these kind of trends before they occur. I'm not talking about, not only talking about virus attacks or something like that. Maybe malaria or mass disease, the disease that affects a mass portion of the population. If we can predict that it is going to happen within the next 10 days or 1 month or 1 year, then it will be very, very helpful for healthcare professionals to manage those things. as far as possible. The third thing is quite interesting. It is preventing fraudulent activities in healthcare claims. Healthcare claims means we know about uh, health insurances, and sometimes people do bad things with it. They claim the money without being uh, sick. We can also stop that. But I'm not into, I'm not very fan of this thing, because this fraud detection is fraud detection. Okay, so anytime we are trying to find out some fraud or fraudulent activities, it can be credit card fraud, it can be health insurance fraud. So I think that is a different, it should be a different topic in case of data science, but it is there. Next up is medical imaging analysis. It is very, very important. Uh, a few times back, one of my students, her father was ill, and for some reason, the X-ray image that was taken was not very clear. Okay, and the doctors, when they saw it, they said that okay, take it again. And that person was very, very sick at that time. By God's grace, he's okay, doing okay now. He's completely, he has been healed completely. But this kind of thing, that what we cannot, as a human, cannot interpret properly. Can it be done through machines? Can it be done through data science? The answer is yes, we can. Okay. So that is very, very important. An X-ray image, a CT scan image, an MRI image. If it, if the machine can understand those images and detect abnormalities, then it will be very, very helpful for the doctors afterwards. Now, please do remember that I'm not talking about replacing doctors. They cannot be replaced, uh, at least in any near future. But I'm talking about augmenting the capabilities of healthcare professionals, doctors, nurses, uh, caregivers, you name it. Augment their capabilities, make them do more efficient work. Okay, next one is predictive disease progression. Uh, suppose again, suppose I'm talking, we are talking about some infectious disease like COVID-19. If you can predict how fast it is going to spread, the portion of the population it is going to spread more, the amount of fatality it may cause, those kind of things can be very, very useful, and it is done. It is done. uh, if you see the reports during COVID-19 disease outbreak, you'll see that doctors was predicting, governments was predicting that the disease is going to be like that in this period of time. It is going to be fatal like that and that. So all kinds of graphs and visualization of COVID-19 progresses. All those things were done using data analytics. Next one is it is very, very interesting to me. Personalized treatment plans. Now everyone has a different type of anatomy, every human being, a different type of different way of healing. Okay, so given a medicine, a particular dose of medicine, one patient will heal faster than the other. Okay, and it depends on a lot of things. Okay, so if we can tailor, if we can customize treatment according to individual patients, and that will be very, very helpful. That will make the whole treatment process uh, accurate, more accurate. It is not at all possible if we use, if we don't use this kind of machine learning techniques or data analytics, because the amount of patient, the amount, again, the population, we always have to think about population. It is, I'm not saying that human doctors are not capable of doing that. They are, but the amount of patients that we are having these days all over the world for different types of diseases, it is not possible for humans to give personalized, customized, tailored treatment to each and every patient. But if we can use this kind of technologies, we can. Okay. Let's move on to next topic. Virtual health assistants. Uh, Virtual health assistant typically means that we are going to have someone who is not human, like everyone knows about everyone know about ChatGPT, I guess, kind of chatbot, and those chatbots are going to solve our problems without consulting any doctor, mind you. So I'm talking about completely automated health assistant, a virtual doctor. It is not there. It is not there yet, but if it is, as and when we get it in the future, uh, it is going to be a milestone for the humanity. Because if that is the case, then for a country like us in India, one hospital will be able to serve hundreds, even thousands of patients in villages. Uh, in Asia, in Africa, there are more villages than cities, and people in villages, they have less access to healthcare system, uh, let alone good healthcare system, and most of the population are in the villages. So if we can use this kind of technology where a single doctor is not needed, everything is automated for a lot of diseases, maybe some high rank diseases, some serious illness, for some serious illnesses, doctors, human doctors are there. But for other purposes, a robot is there, chatbot is there, through phone, through computers or whatever, it is providing treatment to the patients. A very, very promising area of study. It will be there, believe me. Not now, but it will be there. Next up is robotic surgery. It is being done. It is already being done. Now, one question will arise that why we are going to use a robot for performing surgery. See, a human being, uh, when it performs surgery, I have utmost uh, respect for surgeons all over the world, but there might be some human error that may happen just because the surgeon is a human. Maybe the hand will tremble a little bit for a millisecond. Maybe the incision will be 1 millimeter longer, and that might cause a patient his or her life. There is another thing. Let me be a little bit animated. See my hand? Now this hand, I can bend it like this. So it is 90-degree bend. And here I can bend it like this, 90-degree bend. So 180-degree range of motion. Here, not so. Here, not so. And the fingers, again, 90-degree motion. And we can perform everything with our fingers and hands, I know. But what if we have a robot hand, and we do in case of robotic surgery, that has full range of 360-degree motion. It has more fingers than ours, and it is not going to tremble. It is not going to uh, be nervous anytime, and it is going to augment. Please, I'm going to stress on the word augment, because it is not going to perform the surgery on its own. It is going to augment the human surgery, and it is being done. Believe me, we are going to see an example after in this presentation itself. Next one is AI-driven diagnostics. So I was talking about say CT scan and MRIs and interpreting those things. But what about blood test? If we can perform a blood test within seconds without the intervention of any humans, believe me, those who have patients at their home will know that how fast we can treat a patient, because a blood test can take 2 hours, 3 hours, 5 hours, 6 hours, sometimes 3 days, 72 hours, so on and so forth. And apart from the nature of the test, 30 to 40% time are spent because the person who is going to perform the test is not available. So if we can speed up things over there, again, it will be very, very helpful. Moving on. So now I'm going to be a little bit more detailed about all those things that I've said. So those were main things, main topics, and I'm going to delve deeper, a little bit deeper into each of those things now. Predictive analytics. Under this, we have risk stratification, early disease detection, and personalized treatment plans. Risk stratification. Stratification is a fancy word. It just means groups. Okay. So risk grouping. The first point means risk grouping. So if we can make or create groups among population that these kind of people are more at risk from this kind of diseases, then we can provide that type of healthcare to those type of people. Let's take an example. Suppose COVID-19. Okay. It was not affecting children's. By God's grace, it was affecting uh, from teenager to older people. Who were more at risk? The older people who already have some diseases like blood pressure, like blood sugar, some heart problems, some kidney problem, and something like that. Those patients were more at risk from COVID-19 disease. We have seen it repeatedly. So if we can create this kind of grouping among population all the time, please do remember I'm talking about all the time, not only when some dangerous disease outbreak is there, but all the time. Then our healthcare system will be more efficient and at delivering treatment to those people. Early disease detection. Next point. What is this? Uh, we all dread cancers, right? So if someone says cancer, it sometimes it automatically means that all hope is gone. But these days, if the disease is detected early stages, it can be cured, and it is being cured completely. And the person who is going to have a full life, disease-free life, as long as he or she lives. But it is needed, early disease detection. How we can perform it? We have short in manpower. We are short in pathological centers. We are short in awareness. We are short in hospitals. We need something that can reach to each and every individual in this world. Okay, so predictive analytics can do that. Personalized treatment plans. I have already said about it. I'm not going to use many words now, but it is very, very important. What I have said was convenience, right? Convenience and effectiveness. But if you just research only a little bit, you'll know that genetically we are different, even a little bit from each other, even from our parents also. And medicines should be genetically tailored. Okay, so if I'm taking a paracetamol for, say, runny nose or flu or something like that, you should not take it. You should take paracetamol, but in some different dose. That will be more effective on you. So that kind of thing can be done through predictive analytics, and it is going to make patient care or patient outcomes more positive. A few examples. I do not have time to go there and talk more about these things. All these things have been done. I have only shown two examples: IBM Watson Health and Google Health and DeepMind. Now, IBM Watson and Google DeepMind, these two are early systems of artificial intelligence. When I'm saying early, they were discovered early. They were created early. They are in no way less effective than any of the present system that we are seeing today. So DeepMind, IBM Watson, they can be used for different purposes, but they have great many applications in healthcare also. I have included the link. If you are interested, you can go and see. Next one is medical imaging analysis. Now, medical imaging analysis, I have listed only two, only three. There can be many. There are many. One is tumor detection. So, a tumor, it can be malignant or benign. If it can be predicted, and it can be predicted by a machine, by an algorithm, by an AI system, machine learning system, whatever you may call it, whether it is benign or malignant, then treatment can be started more early, proper treatment. Next one is fracture detection. I already have given one example of it. A person was his spine was fractured, and the detection cannot be done because the X-ray was not very clear. So if it can be done, even for a hazy or not so clear picture of X-rays, what we as human cannot see, cannot detect, the machine will do it, and they can do it. It is being used already, not in a mass scale, but it is being used successfully. Next one is organ segmentation. Segmenting organs in medical images for treatment planning. What is this? Suppose we are talking about blood sugar. Okay. Now, blood sugar is a very, very serious and fatal illness that affect a lot of organ in human body. For example, eye, heart, kidneys. Okay. Now, when some medical imaging like whole body scanner or something like that is being taken of a patient, if we can segment those organs that can be affected by blood sugar or for any other disease, and enhance those parts of the image. Then again, the proper treatment can be performed. More effective treatment can be imparted to the patient. Two examples, Zebra Medical Vision and ADOC. What they are doing, they are using algorithms. Both these companies are using artificial intelligence algorithms to find out liver diseases, osteoporosis, lung diseases, and so on and so forth. And ADOC, the second one, see, they are their algorithm can find out intracranial hemorrhages, internal hemorrhages, uh, pulmonary embolisms, means lung problems, and those algorithms can flag, they can flag, they can raise a red flag. Okay, this patient needs urgent treatment. This patient does not need that urgent treatment, but it is okay, more or less okay. So we can be more, we can give more attention to the patients who need it more. Fantastic initiative and high rate of success. Please visit those sites. Next up is personalized medicine. It excites me so much that I'm talking more and more about it. Genomic data analysis. What I've said just for this, every medicine should be tailored according to the genetic sequence of the patient. Okay. It cannot be, it is still in the research phase. It cannot be done only through human intervention. We need machines for it. It is so complex thing, but it has been proven that we need a medicine that is tailored according to our genetic sequence. Next is pharmacogenomics, and again, it is the other way around. When we give some drugs, some medicine to some patient, how the genes is reacting. So we are talking about cell level responses of the patient, not only organ level, but cell level. Every cell, inside that we have chromosomes, and inside that we have genes. So how those genes are affecting according to when we are uh, administering some medicine, uh, those kind of studies can be done through data analytics or data science. And lifestyle based personalization, suppose someone is so busy that he or she cannot take medicines during um, say 10 a.m. to 9 p.m. So what kind of medicine we should give that to the patient, considering lifestyle factors? What should be given to same disease? One is an athlete, another one is say a banker. Uh, we should give them different medicines. We should give them different doses. It disease and type of lifestyle both should dictate the kind of treatment we should provide, and it cannot be provided by human alone. Uh, Two examples, Tempus and Foundation Medicine. Again, they are using artificial intelligence, uh, analyzing molecular data, clinical data, genomic profile of patients, and administering uh, proper medications according to that profile. It is not possible through only by human doctors. It is not possible. Tempus.com and Foundation Medicine. Please go there and see what they are doing. Very, very exciting things. Okay, virtual health assistant. So, symptom checking, medication reminders, mental health support. What is symptom checking? we are already seeing some examples of this. Apple Watch, it has a built-in ECG monitor, and it has in fact alerted a patient and nearest hospital about upcoming uh, heart attack of that patient. It is documented. Okay, so giving a symptom of a patient, it is not possible for everyone to go to doctor's place or hospitals to check up every time. So if we can have smart watches, smartphones, everyone uses it, and if we can use those things to perform medical diagnosis, symptom diagnosis, and things like that without human intervention. And when I'm saying without human intervention, I'm talking about machine learning. I'm talking about artificial intelligence. I'm talking about data analytics. Those things can be done, and those little gadgets is going to be more useful for saving a life of a person than any doctor on this earth, because those little gadgets will become a personalized doctor that is every time uh, watching the health of that person. Next one is very uh, simple but very important: medication reminders. How many patients have you seen who forget to take their medications? uh, take a guess. 90%, 80%. Is the percentage is very high. Everyone forgets to take their medication on time, but it is very important that the medications is taken on time for each and every patient. So if we can have a system, artificial intelligence system, that can do that, then it would be very okay for those people. Next one is mental health support. I'm going to talk about more about this thing later in this video. So let's skip that part. There are two companies, Livongo and ADA Health System Checkup. And what they do, they help patients like say Livongo, conditions like diabetes, analyzing data from connected devices to provide personalized health insights and recommendations. So suppose a person who has diabetes uh, has more risk from hypoglycemia, means when the blood sugar level drops suddenly, than from hyperglycemia, means when the blood sugar level spikes. So if the machine can detect that this person is going to have a low blood sugar attack in the next 15 minutes and can alert the person, then proper uh, medications, proper food can be given to that person. Eating a candy perhaps is going to raise up the blood sugar level automatically. But if it happened on that person, then it is very risky. It can be life threatening, and it is life threatening incident. Now, Livongo, ATA Health, AI system checker, they do things like that. They remind about medicine, taking medicine. They remind about upcoming low blood sugar uh, incidents. They remind about they uh, warn about possible heart attacks or possible strokes or something like that. Again, please go and check. Next up is robotic surgery. I've already talked about this thing: minimally invasive procedure, precision and accuracy. Why minimally invasive procedures? Because when we are talking about robots, we can build uh, a robotic eye into the robotic fingers itself. So every finger of the robot it can perform incisions. It has a built-in eye over here itself, and that eye can be anything. It can be an infrared eye, it can be a normal eye like ours. So it can see and it can do things that we normally human won't be able to do in such a short span of space. That is why minimal incisions are coming. A normal doctor may need to make the incision longer incisions. A robot will not. Precision and accuracy. I have already talked about this. When we are talking about metallic hands, it has full range of motion, more range of motion than a human doctor, and it will be more precise. It is not going to fumble. It is not going to tremor in any point at any point of time. It is going to be more precise without any doubt, and reduced surgical complications. What are these? From surgery, uh, the most risk after surgery, that is the risk of infection, and that infection might cause from the doctor or the nurse who are there in the surgery operation theater. But if we can use a robot that has no bacterial infection, that cannot have any bacteria, cannot have any virus, then after surgery infections, chances of that, we can minimize that. We cannot eliminate that, but we can minimize that. I have given only one example because there are systems, there are other systems, obviously, but this one is the most famous of them all, Da Vinci surgical system. And let me go this go to this link for a little study. Okay, so this is the Da Vinci system, robotic system, and see, doctors are there. You need surgeons. It cannot be only patients, only robots. See over here, the things the doctor can see, it is magnified 10 times to what human eyes see. Next one, surgeon uses tiny instruments that move like human hand, but with a far greater range of motion. The system's built-in tremor filtration technology helps your surgeon move each instrument with smooth precision. The whole system, how it looks like, it looks, what are the images? What I have seen, there are 8 or something hands. Okay. It looks something like this. 4 hands. So at the same time, you can think of 2 surgeons are working on the patient at the same time. And these are 2 separate systems. This is vision card, this is surgeon console, and this is where the actual surgery will be performed. Okay, enough of that. Let me go back to my presentation. Amazing things. Okay, without robots, without machine learning, without artificial intelligence, it couldn't have been done. But it is being done. It is no longer science fiction. It is no longer magic. Next up is, it is another part of healthcare system that needs to be taken care of very seriously, and that is clinical documentation. Clinical documentation, what does it mean? When a patient is discharged, when a patient is treated, whatever be the result, positive or negative, it is documented. It is documented by doctors, it is documented by healthcare professionals, by hospitals, by governments, everyone. Because those thinks that this medicine has done this thing to this patient is a piece of knowledge. That knowledge can be used and is used by uh, other people, other doctors for other cases like that. Now, this clinical documentation, it is a huge task. For every patient, the record has to be kept. The treatment uh, outcome has to be kept. What treatment was performed, what medicine was given, that has to be properly documented. Can it be done automatically? Yes. Can it be done through voice commands? Yes. And can it be more streamlined in terms of time? Yes. Through AI, through machine learning. Uh, Next is information extraction. Whatever documentation that is being done, it is done. Next up is, what does those data mean? A classic problem is problem for data analytics. Classic problem. Solve, solution, data analytics. Perform data analytics on those data. And patient interaction and enhancing communication between patients and providers. When a patient is discharged or admitted, conversation, knowing the patient is very, very important. And based on that, that documentation will be uh, created, right? So if a patient or patient party, whatever, if we can talk to those people more, then we would know more about the symptoms. If we examine the patient during the treatment phase, then we would know more about the progress of the treatment. After the patient is healed, how he or she is feeling, what are the things that are happening. The more we interact with the patient, the more knowledgeable we are. That can also be done through automated systems powered by AI. Two examples, Nuance Dragon Medical One and Amazon Comprehend Medical. This Amazon Comprehend Medical, it is free for certain use. Um, very interesting. And it is completely cloud based. You don't need to have a big machine or laptop for it. You can do it from your own mobile itself. Please go and check. Do not have time to go into these things in more detail. Drug discovery and development. So drug discovery means whatever medicine that we are taking, all these medicines are created by research. And research can be accelerated through the use of machine learning, through the use of neural networks, through the use of artificial neural networks. And it is done. Remember COVID-19? Through two vaccines, one made by Pfizer, another made by AstraZeneca. Those two were created within what, 6 months, 8 months? Fast, very fast. It could not have been done had it been 10 years back, 20 years back. Only through machine learning, only through analyzing vast data sets. Because whenever we are creating some medicine, we are going to administer those medicine to lab rats. With all due respect to rats, lab rats and smaller animals, to see how the um, medicine is working, and only when we are satisfied, then we can administer those medicine to the humans. Now again, uh, what are the effects of those drugs? That data need to be analyzed. That analysis, speed up the analysis, speed the drug discovery process is has been sped up. Okay. In silico medicine and benevolent AI, two companies that are doing biotech companies, they are doing exactly that. They are using machine learning, artificial intelligence to for drug means medicine research, okay, reducing time and cost of development. AI for mental health. I cannot stress more about mental health because it is the biggest disease these days. No one talks about it because it's kind of taboo. But each one of, I'm not going to say each one, but most of the people has some form of depression, anxiety, melancholy, things like that. Maybe it is because of the food we are having, maybe because climate change, maybe because the society has become more complex, jobs has become more complex, family life has become more complex. It can be anything, but we have mental issues, mass mental issues, but we do not have enough professionals, enough privacy to admin to solve those problems, because someone for someone to solve his or her mental problem is to take the first step, and that is go beyond the denial phase. No, I'm okay. Everyone will say that I'm okay. I do not have any problem whatsoever. It is not the case. And people say things like that because they they're scared about privacy. Now, these two chatbots, they can talk to you, they can talk to anyone and solve to some extent the mental health problems. Ginger and VWAT. Next thing is Internet of Medical Things. Internet of Medical Things. What are Internet of Things? Internet of Things are small computers, small chip-like computers that are embedded into devices like smartwatches, like smartphones, smart TVs, and so on. Okay, but these devices are medical devices, and we can integrate those devices uh, to collect data, analyze data, and take decisions accordingly. Philips Health Suite and Medtronic's Guardian Connect. This second one, Medtronic's Guardian Connect. Medtronic is a company that primarily builds um, pacemakers, but they have glucose monitoring, means diabetic monitoring systems that will uh, warn a patient about upcoming low glycemic events, means low blood sugar events, hypoglycemic events. Fascinating. These things are so that was okay. Now, what are challenges and ethical considerations? Everyone's medical data is confidential. We cannot uh, reveal those data to a cloud system, to a company, without taking proper permission from the patient, proper permission from the hospital or government. Second thing is biases in AI algorithms. What algorithms we are using? Are they biasless? Are they perfectly okay? Can we depend on those algorithms 100%? There's a question of that. So, uh, but should we uh, forget about it? Should we discard it just because there can be some problem, uh, ethical problems and bias related problems regarding this AI healthcare? No. And Google's explainable AI, DARPA's XAI programs, they give a guideline uh, of how we can create healthcare system uh, that is more transparent, biasless, and explainable to everyone. So that concludes my uh, demonstration or webinar for today. If anyone has any questions, I'm up for it. I guess not. So thank you and good evening, everyone.